I'm 29 years old and not trying for a pregnancy. I have an AMH of 1.8 pmol per liter. What should I do? Based on the evidence of an AMH of 1.8 at the age of 29, that is significantly below the typical range at your age, that is between 13.1 to 53, indicating a diminished ovarian reserve. While it is known that the AMH naturally declines with age, the rate is highly individual and unpredictable. Let's look at the evidence. The general decline, the AMH declines by about zero point 0.2 nanogram per ml per year before, and that is equal to over 1.4 pmol per liter per year before age, slowing according to zero point 0.1 or zero point 0.7 pmol per year every year. For somebody who's 29, that would mean that the decline could be anything between 4.2 to 8.4 pmol over 3 years, potentially nearing undetectable levels. However, this is an average and individual rates vary quite significantly. At the age of 29, your AMH is already very low, under the 10th centile. And studies show that with a low baseline AMH, women experience faster decline of follicles and an earlier menopause. But again, that data is limited. In similar cases, AMH of less than 1 nanogram per ml or 7.14 pmol a liter under the age of 35 had a median time to menopause of 10.1 years, and the level of 1.8 pmol suggests a heightened risk of accelerated decline. If you have an antral follicle count of around 12, that represents a normal range. 8 to 12 is a normal range, and it indicates an immediate, proper, and a good ovarian reserve that is immediate. AFC often corresponds to natural fertility potential, even with a low AMH. Regarding natural conception, low AMH does not preclude natural pregnancy, and there is no link between AMH and natural pregnancy, but both decline with age. Age has a negative impact on pregnancy. What is the option? What does the AMH do? The AMH to a certain extent predicts the response in IVF, and while your AMH is low, the antral follicle count is good to embark on IVF or to embark on embryo freezing or egg freezing. Both of these come without guarantees, and the best advice would be to maximize the chance of pregnancy is to try for a pregnancy sooner rather than later, and that's the best way of testing fertility. Delaying pregnancy by 2 to 3 years runs the risk of AMH reaching undetectable levels, and if you were to need IVF, then the chance of getting eggs are going to be incredibly difficult. No one can pinpoint the exact decline of egg reserves, and evidence confirms that. Important to remember that the low baseline AMH correlates with a steeper decline, and at present, at your age of 29, the window is good to consider trying for pregnancy. If not, then to freeze eggs or embryos if your follicle count is good.